Welcome to Vallejo PT, Vallejo Physical Therapy Online, guys. Got a patient request video that I'm shooting today. We're going to look at, the good old crick in the neck, or the neck tightness or pain after waking up. And so what we're going to look at here is doing basically a facet joint mob, or a side joint mob of the muscle, or the bone on the side of the neck. that can sometimes, if you've slept or been in a certain position for a long period of time, get up, move quickly, some things don't get out of the way, you start pinching some structures, or you can get some joint capsule irritation around those little bitty joints around the neck specifically. So I'm going to show you guys how to do a self-mobilization to that area. So the way we're going to start this up, a couple quick things though on this. We're going to try to shorten the muscles up, but there's really, we can't completely take away the soft tissue, all right, from this area. So we're going to put ourselves in the best position that we can to get rid of that and really try to get rid of that soft tissue and really try to make this as good as we possibly can at mobilizing or gapping or opening up the facet joint, or the joint on the side of the neck bones. All right, so let's jump into that. Cool. So what we're going to do to set this sucker up is, first off, we're going to take depends on what hand what side of the neck you're dealing with. So if you've got pain, side bending to the right, rotation to the right, we're going to gap the right. So we're looking at the right shoulder blade. We're going to take that hand all the way behind the back as far as we can. It's going to allow us to tilt that shoulder blade up. So we're going to tilt the shoulder blade and over shorten levator scapular muscle. Okay, so we're going to shorten that muscle up as much as we can. That way it's not causing, that's not the thing that we're stretching. We're not wanting to stretch that levator. We're wanting to actually try to get as much of that joint as we possibly can. So hand behind the back, as high as we can reach it, right there in that position. We're going to then rotate as far as we can away. So we're going to look away from that side. Pain-free, guys. Pain-free. All my techniques are pain-free. All right, we don't need to cause pain to get rid of pain. Not a good combination. Left hand is coming over the top of the head, reaching as far back as you can. All right, we're going to pull that baby down gently. You're going to check and make sure that you put deodorant on this morning. All right, we're going to just pull as far as you possibly can. Again, we're looking for no discomfort here. Stretchy sensation is okay. All right, once we get to that spot, we're going to hold it for just a 2 to 3 second count. 1, 2, and 3. Then we're going to move the hand to the front of the forehead. All right, we're going to push the head back up into that position. All right. Come out of that position, kind of shake it around a little bit, move them shoulder blades around, all right, and then repeat. All right, boom, rotating away, hand coming over the top, and pulling on down. And then when you're done with that, push it back up. Hold. So our hold time, 2 to 4 seconds. Reps, 3, 5, 10. Nothing should cause any irritation. Guys, always use a comparable sign at home. What does that mean? Check your range of motion, do the technique, recheck your range of motion. So you could get an improvement in the quality, how well you move. You can get improvement in the pain. All right, pain level can go further. Range of motion can go further, and the pain levels can drop. Okay, so make sure that you're double checking comparable signs on all of those things. Again, guys, that was a self-mobilization, the best that I have for using no equipment at home, self-mobilization of a facet joint in the cervical spine. Paul Kowalski, Vallejo PT, Vallejo PT Online. See you next time.